Recording in progress.
All right, welcome everyone, and thank you for joining us for today's webinar. My name is Donna Chow, and I'm your host and your moderator for today's class. eLotus is your leading provider for continuing education for acupuncturists, and today's webinar is Understanding Jimmy Chang's Clinical Proven Formulas, Part 1, presented by Dr. Jimmy Chang. There are a total of 6 classes, and today's class being Class 1 with formulas for pain. If you enjoyed today's class, you can save 10% on his next 5 webinars if you register for them all at once. So today's webinar will be from 2:30 to 4:30 p.m. Pacific time, and we will have one break. If you have not done so already, please go ahead and get a copy of the lecture notes from the Blue Course Access page in your account. And if you'd like to join the chat, please set your chat preference right now to everyone so that we can all see your response. And for the questions for our speaker, please type them into the question box in your Zoom control panel, and he will answer the questions as time allows. And finally, the quiz and video replay will both be available tomorrow, and you will receive an email notification when they are ready. And as a reminder, this is just for people who have paid for the class. For our Watch It Free group, you can go ahead and still purchase the class and receive CEUs as well as the video replay. Okay, so our speaker today is Dr. Jimmy Chang, a doctor of Oriental medicine trained in Taiwan and a licensed acupuncturist in California. He has over 40 years of concentrated clinical experience treating over 500,000 patients and applying his expertise in differential diagnosis and herbal prescription. In today's class, you will learn the tried and true formulas from Dr. Jimmy Chang as the master of herbology. He will explore the art and science of his unique herbal combinations. You will learn about a range of herbs for pain relief, as well as how to identify the pulse indications associated with specific conditions and how to prescribe a unique herbal formula for your patient. There is no need to reinvent the wheel. Take what has worked through Dr. Chang's clinic and see results in your practice tomorrow. Dr. Chang has previously taught numerous courses with us, which is now available for purchase as distant learning CEU videos. Dr. Chang is the person to learn from if you want to be able to feel a patient's pulse and come up with a custom formula from the reading. If you want to cultivate your pulse diagnostic and herbal skills, he is the person to learn from. When I return to my computer, I'll post the link for you in the chat room. Okay, guys, let's go ahead and begin today's class and welcome Dr. Jimmy Chang.
Hang on, guys, hang on. All right, guys. All right. Okay, Tina, you want to go ahead and start the intro?
Right. I'm over here. Hi, everybody.
Yeah, we see
I'm in a different
clear.
room joining the class with you guys. And Dr. Chang has asked me to do the first few slides to introduce his class. So can you guys type into the chat room if you're completely new to Dr. Chang's pulse diagnosis and also herbal prescription? If you're totally new, please type in new. Let me see how many of you are new. Well, quite a few. Okay, welcome. Okay, so I'm gonna briefly go over a few intro for you, so then you won't be lost. Can you all hear me okay? Just I forgot to do a mic check. Yes? Okay, sounds good. So Sam, can you help me advance to the next slide, please? Okay, just quickly, I'm going to take about 5 minutes max to describe a few things to the newbies. So then you won't be so lost when we start to talk about his formulas. So pretty much, I want to just tell you guys, this general background. So the first question, people ask is how were the formulas invented? So Dr. Chang pretty much in his clinic, he orders these extract powder from us. And when he gets an inspiration or when he reads certain classical textbooks, he would have different new herbs that he has in mind to use for different conditions because he's always improving in his clinic. So as a result, new formulas are invented all the time, or he combines different herbs, and as a result, through trial and error with different patients and their feedback, and then he has a set formula that he feels is good for a certain condition. So that's how he invents his formula. So then he gives it a special name. Okay. So the second question that people usually ask is what kind of herbs does Dr. Chang use? So he uses exclusively our extract powder. He doesn't use the capsules and he doesn't use raw herbs. So if you are not familiar with extract powder, you can, Donna, can you put in the website for ebherbs.com and you can read more about how the herbs are extracted and how it is compared to raw herbs and all that good stuff. So you're free to choose whatever type of format that's most suitable for your patients. Most of Dr. Chang's patients are Chinese, Hispanic, and American. So then he just gives them the powder in either 100 grams or 150 grams format. Okay, so I put down the link for you to take a look at Dr. Chang's clinic and how it looks and how he mixes formula. So you can take a look at that. Okay, so next slide, please. So the evolutions of the formulas. Okay, here is what will get a little bit confusing for some of you, because Dr. Chang being an artist, he has several names for his different formulas. And sometimes he calls the formula the same name, but he has already changed the ingredients. Okay, so for those of you guys who have been following him, today you're gonna see that two formulas, ingredients are slightly changed, the circulation sanjiao as well as the astringent complex. So he has found a different combination or different herb to add to it instead. So what we're gonna do from now on is, if it's called the same name, but the ingredients are different, just so that we know it's different, I'm going to add the 2.0 at the end of the name. So then this way, we know which version he's using. Okay? So the next question is, what is Fang Jia Fang? So people will ask that question all the time if you are not familiar with using extract powder. Fang Jia Fang pretty much is the idea of adding formula plus formula. It's kind of like the idea of 八珍汤, right? 八珍汤 is the combination of 四君子汤 and 四物汤 to form 八珍汤. So in Dr. Chang's clinic, he uses a lot of different formulas and he combines formulas to yield his secret formulas. This way is a lot simpler because if you combine 3 or 4 formulas, you most likely will be dealing with 20 to 40 herbs. So that's a lot of single herbs to open if you want to mix it that way from single herbs. So then he would just use formula plus formula. And I also link the YouTube video for you to watch so that you can get an idea, more of an idea of what that all means. Okay, so I'm just going to give you just this very general intro because most people already know. But if you want to know more, feel free to watch this YouTube video. Okay, so all the formulas used to add up to 100 grams. But Dr. Chang likes to do 150 grams now because most patients come from afar. And also if you do 150 grams, it is a little bit better in that patient will see better results because it's a little bit longer, right? Because most of the time in one bottle, you won't see too much of a difference unless you're treating some things like sore throat, in which the next day or in 2 days, you should see something already. But most of the chronic disorders, if you give them 150 grams, you should see better results. So then when they come back for reevaluation, you know how to modify the formula better. Okay, next slide, please. Okay, so now some of you will ask, well, do I have to mix the herbs myself? Yes, for most of his special formulas, because That's how Dr. Cheng does it. He has a full pharmacy, and then you just kind of mix and match depending on your patient's need. Now, for some of the popular ones that he has used over and over again, we have made them into a collection formula. So they are pre-mixed already and pre-decocted. So then this way you don't have to mix it yourself. And he has certain formulas that he has with us that we have pre-mixed. And I think there is a list that Donna put up as part of the lecture notes that you can see for the list of the collection formulas. So if you don't want to mix it yourself, feel free to just get it pre-mixed already. Okay, and then let's go to the next slide. Okay, so that's it on the introduction. The next 6 ideas are Dr. Cheng's strategies for relieving pain. So I'm gonna hand this over to Dr. Cheng so he can go over his strategies. And depending on what the patient presents and the pulses and the year findings, he will combine these different strategies. Sometimes just one strategy, sometimes 2 to 3, sometimes 2, sometimes all of them, But I rarely see him do all of them. Usually it's about 2 to 3. Usually to move blood, right? To reduce swelling and to reduce inflammation. Those are the 3 most strategies that he uses for pain relieving. Okay, so let's hand the mic over to Dr. Cheng, and so he can take over from here. Hi, Dr. Cheng.
It's still.
Can you do a quick microphone test?
Okay. Can you hear me now?
Okay,
It
thank you.
says unmuted.
No, it's okay. No, fine. It's okay.
Okay. Ladies and gentlemen, can you hear me now?
Yeah.
Okay. Today we're going to talk about 6 pain relieving strategies with herbs. First, move the blood. Secondly, reduce the swelling. Third one is reduce inflammation. And the fourth is open and relieve spasm. Warm the yang, tonify qi. That's not necessarily important, but anyway, well, we're going to do it today. Okay, we have several, what's wrong with this? Combination, we call it combos here today for you. If you learn it, you can use it right away in your office and you will see the result very, very fast, even much faster than your acupuncture treatment. First is the mighty combo that for all the kind of lumps in the body, mental disorder, pain, and poor circulation. And you have to justify the diagnosis by yourself, but I'm telling you what this combo is for. The second one is the pain combo for various unknown pains. You don't know, a lot of people have a lot of pains, and most of the time, the Western doctor cannot tell why the pain is there or why the pain occurred a long time ago. But you can use my pain combo to deal with a lot of variety of different kind of pain. Third is Circulation Sanjiao 2.0, second edition, specialized in treating various kind of a lower abdominal pain, which was caused by blood stasis or the stagnation, menstrual pain and blood stasis in the woman. Not necessarily in the woman. It's also some for people, for men and male and young and old. Not necessarily for the abdominal. Sometimes their feet, their legs are swollen with a dark stasis, and this is the perfect case for that. But when you decide to use the Circulation Sanjiao and all my blood moving combination, you should know if the patient is taking blood thinner or not. If the patient is taking some kind of a blood thinner or aspirin, you have to be careful with your moving the blood. And the number 4 is the most extinguished design from me. Astringent complex treats swelling and inflammation of various organs. And how do we know there's an inflammation or swelling condition in the body? Then you have to rely on your pulse diagnosis. If you're not so good about pulse diagnosis, then the ear point will give you good clues for that. Well, it would be better if you learn my pulse diagnosis system. Is very, very useful. And the spasm combo, in this case, you might need to know a little bit about pulse diagnosis because ear sign cannot show the spasm condition. Treat various muscle and bone spasm, spasm, cramping pain, yes, the contraction, menstrual pain, and the lower abdominal area. Not necessary for the women, men too. And the people with the hernia or swelling prostate, something like that. The number 6 is the opener, specialized in treating cold symptoms. Yes, cold symptoms, I like to call it constriction. The pulse will be very thin and tight, tightening spasm, pain caused by various meridians. And the opener will open up a traffic jam in the meridian. The traffic jam, you should imagine that there's no rock or car accident in the highway. It's only the narrowing of the highway. For example, there used to be 4 lanes, now it blocked 3 lanes. Only 1 lane is passable. Then definitely there will be some jam. So we're gonna open it up by our opener. Okay. But hey, we have a number 7, no? Okay. I remember I have a 7. Okay, doesn't matter. So we have 6 major combination for pain. Okay. Any questions so far? Okay, let's begin. Okay, this is a general, simple introduction about my pulse. Remember, this is the high bone here. In your textbook, you put your middle finger on top of the high bone to get a result. No, it's wrong. It's been wrong for 4,000 years. So my approach is that put your index finger and middle finger, the middle, put high bone in between these 2 fingers. That's the 寸关尺. Then you can get a good, precise diagnosis from the pulse feelings. So this is the high bone, huh? It's not under your middle finger. It's between the 寸 and 关, the index finger and middle finger. Okay, let's get on with the real business. First is the mighty combo. Treats various lump. How do you know this lump? The pulse will show, but sometimes it doesn't. You can just verify it by the by my ear point. It's very accurate. Inflammation, mental disorder, pain, poor circulation. So this combo is not only for blood stagnation, also good for all kind of inflammation. How do we have inflammation for the pain? It could be the acute injury, like twisted ankle, twisted arm, or whatever. All the pain caused by new injury. By saying the new, it can be the things happened, occurred, took place in the past few weeks, not just yesterday, but the old various, the injury can be years before, but also we can take care of them all, everything. And the reason I invented this combination, because I got a strange feeling that everybody, all the patients has some kind of a lump inside. Maybe cannot be detected by MRI or X-ray or the pulse, but I believe there's always something there. So I designed the entire combination that treats lots of interesting cases, which you might, it's kind of difficult to imagine. But anyway, let's see the head. Let's see the ear point. See this? This one is the testicle or ovary for women. And this is the lump, actually is above, we will say it's above the testicle, or could be the ovarian cyst, or could be the prostate swelling. And this, because the color is not red, so I don't see much inflammation there. But anyway, this is a lump. He or she might definitely will have some symptoms. And see, this is the head. See the darkness in there? This area is the head. So I can tell there is some kind of an old injury, old blood stagnation in the patient's head. Okay, could be some kind of a trauma or not, but he will definitely have some headaches sometimes. And this one is the neck and shoulder. Okay, I didn't circle it because it's not for that. And this area, you have to look from this side to get the side view of this inner part of the ridge is the breast area. If you see a darkness there, that means it's a lump in the breast. If you see a red color there, it might be some inflammation. Okay. Where's the color? Oh. If you see something red there, there's inflammation and maybe some hyperplasia, the swelling of the breast tissues. If you see a dark spot there, then there's blood stagnation. See, there's a little darkness here. And there's no darkness there, but still my formula still works, okay? And let me give you a hint. If, if you see a lady, one ear is red, the other ear is dark, then that's possible breast cancer. Be careful, huh? So this combination, I use Ru Xiang Mo Yao to mimetize all the bad cells growing in the patient's body, and Sanren Erzu to destroy all kind of lump, no matter where. And something could be very not detectable or invisible, but still the Sanren Erzu will work. So I use it a lot. And this zhizi, zhizi is a very interesting fruit. There's an old Chinese saying, one fruit of this zhizi, one day you keep the cancer away. So the zhizi is very good for cancerous condition, which cause inflammation and stagnation, and for all kind of a swelling tissues or organs or bones or joints, whatever. Anything with a fire, you can use the zhizi. So how do you know the pulse signs? The pulse signs, usually with this condition, the pulse will be scattered. In my system, it's called scattered pulse. The pulse is very deep and not jumping. Or you can simply look at the patient's face. It usually can be very dark and with a brownish color and very dimmed skin. Looks kind of a dirty and not healthy. And for zhizi is for jumpy pulse. So sometimes it's a combination of stagnation and inflammation. If you have problem to distinguish them, then you just simply use my 100% of this magical combo. Okay, my multi combo. Okay, this is, and zhizi is a red color, but it's heat cooling herb, so it's good for clearing the heart fire. So what is the heart fire? That's mental disorder. This goes with the hook pulse. Remember in my pulse energy book, the hook pulse means the upper is very jumpy and the rest of them are kind of relatively low. The hook means heart fire. And in other words, it means Shaoyin condition, Shaoyin fire. Shaoyin means heart. Actually, there's also a kidney fire there. So how come there's a kidney fire? That's hormonally related. So whenever there's a lady with a menopause condition or other kind of mental disorder, if a hook pulse appeared, then you can just simply use my zhizi. It works very well. When you use the combination of all my medicine herbs, And when you put into the bottle, I usually give them 150 grams per treatment per bottle. If you want to use 100, okay, then you have to. I always make a decision: how much percentage for heat clearing medicine, how much percentage for blood moving. I think you should put that idea in your mind when you start your prescription. In this case, like look at from the combination, looks like 80% of them are blood moving. Only one is, sorry, no. 80% is blood moving herbs. Only one zizi is for heat. You can adjust the percentage by yourself. Depends on the patient's condition. Okay. Oh, 这怎么清掉 ？OK， 这里。Any questions so far? Any questions? When the formula change, we will be updating clinical menu. Okay, no problem. So I always put in the big jar. There's premix in my office. So when I use it, I just simply write down the name and Mighty Combo or whatever. My lady will put them for the patients. Very easy, much easier than acupuncture. No question? Okay. Let's go down to the second one, pain combo for various unknown pains. So most of the people have pains, usually 100%. Nobody can tell me that he doesn't or she doesn't have any pain. So if you're not sure the pain is coming from internal organ or from arthritis or from injury or from the tendons, the dumai, zenmai, period pain, or the stomach pain, or gallbladder pain, or joint pain. I mean, the neck and shoulder, or headaches. So, okay. Then you just save you a lot of trouble. Just use this pain combo, various unknown pain. But and how do I make the diagnosis that to know that there's a pain in the patient's body? Okay, we can use the ear sign. If you're not too sure about my pulse diagnosis, let me take a look at this. See, there's a lump. This is the hip area. So this is a bulb, that's a lump. See that? And this area is the neck and shoulder, okay? And this again, this it should be a man or something. See the lump? See the lump around the genital area. It's dark, though, there's blood stagnation. And also here too. So this patient has too many blood stagnation and lump at the same time. This one is flat, so it's not off. I mean, the surface is flat, so it's pure darkness. I mean, brownish color. That's the stagnation. And this one is popped out like a little bean. So this lump. So you can choose to use my first Mighty Combo or this one too. And this is neck and shoulder a little bit, huh? But you see this color here, this is the stomach. It's kind of pale. That means the patient is possible being anemic, not in a blood supply. So don't use this one too much, huh? And this one is very interesting. This one definitely showing that the patient's lumbar is bulging out, pressing the neurotic, the sciatica nerve. So you can use my previous Mighty Combo. It will get result fast and interesting. And for this one, again, see this lump up in the hip area. This lump can be some swelling tissues or old injury or people who had operation or had their bone marrow drawn or other kind of a operation will cause this too. And this area is the thyroid. And this one is neck and shoulder. So this neck and shoulder is deformed. The shape of the neck and shoulder is very funny, popping out. So this is the best situation to use my first combo and this one too. If you don't have the first one, just simply use this. Okay? Any questions so far? Oh. Okay, let me talk about this one. 乳香没药 I use a lot in my office for all kind of pain, and not for joint, not for sciatica pain, not for arthritis, also for all kind of internal organ pain. So you must have it in your office. 折冲饮 is also for pain. Most of the time I use it for the period pain, but just good. But most interesting is the 普银. 普银 was used for acute injury. Fell down off the floor or hurt yourself by lifting heavy stuff or any kind of acute soft tissue damage, we use 普银. You can use it all the time, and you can add it to my previous mighty combo, or you can use 栀子 all together. So if you want to make it simple, okay, just use this one. This one is especially good. Or 折冲饮 actually is not designed for joint pain, not for arthritis or a 50-year-old shoulder or tennis elbow, not for that. 折冲饮, remember, is for internal organ pain, for like stomach, chest pain, gallbladder pain, and the urination pain from kidney stone or not, or for just any kind of internal organ pain, like ladies' menstrual pains, things like that. So I use the 折冲饮 majorly for internal organs. Okay, and the pause sign. Ooh. It's jumpy, jumpy, and jumpy. Very forceful, jumpy. If 普银 is hard to find, use 虎杖. 虎杖 is good too. 虎杖 actually is very in a wide spectrum. It can clear the old dead blood. It can cure the new injury. It works like some kind of astringent herbs, and good for cough, for respiratory system, for all kind of acute injury and the pain, headaches, even for high blood pressure. It's very useful. You can just simply use it. And this 乳香没药 is a must. You must keep them in the all the formulas for any kind of pain. Like again, 折冲饮 is for internal organs, stomach pain or something. This patient, the stomach is something not so right here, but maybe not, doesn't hurt him. So just depends on what the patient is asking. Huh? Okay, any questions so far?
So 折冲饮 is used, you said, for internal organ pain, right? Hello, Dr. Cheng?
What is the hook pulse? Please go to my pulse energy book. You don't have one, buy one from Tina. You don't know what hook pulse is? Hook is the part of a heart pulse system relating to the heart. Does Mighty Combo work for skin flash caused by damp heat? Nope. Is this appropriate for patients who have bright red bumps on the skin? Yes, absolutely. What is the formula for 折冲饮? Go to the Tina's formula book and read it. Okay, there's another question here. For this question, prefer to cancer patient is deficient and weak and has a large tumor, and you can use it both. If the pulse is jumpy, would that indicate heat? Yes. Heat cleaner, yes, there's several. Come on, you didn't see that? The zhizi and the huzhang and the puyin is all heat cleaners. Puyin is for for injury, for the for acute injury. With pain combo address nerve pain, of course. Breaking stagnation would dissipate the heat. Sometimes it does, sometimes it doesn't. Okay. And okay. How do I stop this one? Oh, here. Okay, let's go to the next page. I have to close this, huh? Compare mighty and the pain combo. Like I said, it's kind of similar. The mighty combo is 30% of them are used for lump or mass inside the human body, but pain combo don't do that. So if it's the pain in the breast, like there's a lump there, or the lump in the thyroid area, or the lump inside the uterus, or endometriosis, or gallbladder, the swelling gallbladder head, or I'm treating a lady with the swelling pancreas tail. And somebody, the stomach has a lump in there. They have a hernia too. And that condition, you might want to use my mighty combo for lumps because it has sanlin and erzu. But pain combo is majorly just for pain for unknown reason. Actually, there gotta be a reason, but I cannot show you the exactly conditions. But I'm sure you will encounter all kind of a patient, all kind of pain, major complaints, the pain. So if you have not very familiar with my pulse science, you just simply use my pain combo. It works, it never fails. Okay. One question. Okay. Circulation sanjiao specialized in treating various kind of a lower abdominal pain, menstrual pain, and blood stagnation. This one, like the name of it, circulation. Circulation means blood stagnation. So this one is especially designed for pure stagnation, like a traffic jam. I use this one. Okay, this is based on somebody from Qing Dynasty. This guy, Mr. Wang, Dr. Wang, is very good with the combination, all kind of blood moving formulas. He used this one for all kind of a major problem. Let me tell you something. There's more under the name of circulation sanjiao. First is 血府逐鱼汤. If you want to talk about 血府逐鱼汤, I can talk about 3 days and 3 nights without the end. 阁下逐鱼汤 and 折冲饮. So in using this kind of a combination, you must be sure that the patient is not taking any blood thinner. Otherwise, you don't touch it. It's too dangerous. As for 血府逐鱼汤, it's a very famous invention, very popular invention in Qing Dynasty for everything, not only for pain. I'm talking about pain here, but 血府逐鱼汤, please bear in mind. let's put it this way. When you're treating a patient with different kind of complaints, insomnia, anxieties, stress, neck pain, stomach, upset stomach, menstrual condition, joint pain, and even fatigue, stress, and everything. When you try everything, all the formula according to the following the patient's demand or following the patient's major complaint and then work, try this 血府足浴汤. Especially, we'll be talking about something about this autonomical disorder, which is very popular in modern world. Everybody has said it's either stress or depression or anxiety. If you use all kind of tranquilizer, it didn't work, try this 血府足浴汤. People with nightmares, with somebody walking in their dreams, somebody just start yelling at night and doing a lot of crazy things, try 血府足浴汤. And 阁下足浴汤also. But in my idea, 血府足浴汤, I use it mostly for upper jaw. So the 寸, not yet. How do I go back? The previous page. Stop. Oh, okay. Stop it. Okay. Okay. The pause will be like this. 寸 1 尺. The 寸 is deep and scattered. If you don't know what the scattered pause is, go to my pause book. And the 寸, I like to use 血府足浴汤 for all kind of problem appear on the upper jaw, the head, the neck, and shoulder. Majorly is the mentally disorder. If a patient have a problem with the sleep, with the concentrating or focusing on the job, or have bad temper or being bossy or whatever, if all other combination failed, try this. And also, 血府足浴汤 is good for skin condition, for menstrual, even for wanting to have a baby, for digestion, everything. And 阁下足浴汤, 阁 means diaphragm, 下 means under. So I use this 阁下足浴汤 for middle jaw, for the problem in the middle. Stomach, liver, gallbladder, and kidneys. So some kidney problem, the circulation, the circulation, the filtration rate of the kidney is lowered, somehow not functioning properly. I use 阁下足浴汤 as part of my combination. But for the digestion, of course, the middle stomach, people, I feel like throwing up. I don't feel like eating. You can use 阁下足浴汤. When people saying, I'm so frustrated, my mind is not focusing, then you also can use 阁下足浴汤. So not only for pain, for stomach pains, definitely I will use it. And 阁下足浴汤 also good for the back pain, if the back pain was caused by some kind of a lump inside stomach area. And 折冲饮, like I mentioned, for all kind of internal organ pain. So I use this combination for all kind of stagnation. For example, like this one. Okay, see, this area is red, but this is not the upper jaw, this is the head. Actually, I would say this area is the inner ear, which will cause like a dizziness. See those lines there? That means the sleeping condition is terrible. See this area? This is the colon. And this is the, actually following this line, this one is the urination system. And the combined, here and here, the testicle. Ooh. There's some blood stagnation or lump on the testicle area. So this guy must have some kind of urination discomfort. And see the redness here? That's the inflammation of the colon. And see the brownish color here? That's the hip. That's gotta be some kind of a old injury. And see this area? This is the pelvic. It's all dark. That means all the dead blood in the abdomen area. He definitely will have pain. This is the head. See? The head, so blocks blood stagnation. But this area has some kind of a redness. That means inflammation. So you can use this circulation sanjiao or even my pain combo or first the mighty combo. They will all work. Any questions? Okay. Any questions? Let me see question and answer. We have an anonymous attendee. 少腹足浴汤 does not much for abdominal pain. What do you do with patient on blood? What do I do with patient on blood thinners? I will let you know later. Have you paid the fee? What do you use for 阁下足浴汤 for kidney? Oh, the kidney combo. The kidney combo will be talked about in the coming different seminars. I have a very good, very interesting, I get a lot of cases and herbs combination for kidney function, not for sexual hormone kidney, for real kidney. For example, the BUN is high, the creatinine is high, the EGFR filtration rate is low. I can do that. Okay, so the circulation sanjiao is for all kind of pain, not necessarily the body trunk, also for legs and the swelling feet, everything. See, compare the use of 血府足浴汤、阁下足浴汤、折冲饮 use alone versus combo like circulation sanjiao. Or you can do whatever you like. You can use them separately. For example, like I said, 血府足浴汤 is for upper jaw. That's what I use. Actually, it goes everywhere. But majorly, I'll be focusing on the upper part, 血府足浴汤. Like I said, emotional headaches, especially those headaches cannot be treated by 川芎茶调散. Then you can use 血府足浴汤. And for people with eye problem, I was treating a young girl, 17, with the problem with the eye vision and everything. I give her the blood combination plus 龙胆泻肝汤 because she has liver fiber and the liver gallbladder channel goes into the eye, and I use it. And even she's been treating by steroid, and now the doctor said she's making a lot of improvement. Her parents was very happy. Well, so 血府足浴汤 not only for the pain or something, it's for all kind of stagnation in the upper jaw, for like old injury, trauma, whatever. And especially remember, 血府足浴汤 is good for emotional disturbance. 阁下足浴汤 like it just, if you can read Chinese, that will be more better. 阁 means diaphragm, 下 means under or beneath. So it's in the middle jaw. 折冲饮 is for all kind of organ pain, internal pain. use alone with combo like this. Just put them all you want, use one of them is fine. Put them together are stronger. There is a very a famous formula called 阴沉蒿汤. Have you guys ever heard of it? It's a combination of 大黄, 栀子, and 阴沉. It's for gallbladder problem, gallstone, gallbladder, all kind of inflammation, swelling gallbladder, even for liver cirrhosis, cancer, and gallbladder, and even for pancreas inflammation. They studied it. If you use 栀子 alone, okay, it works too. If you use 阴沉 alone, yeah, it works. And if you use 大黄, it won't work. But put them three together, they become a very strong, mighty group, and it can destroy everything. So that's what I'm doing here. 方加方, as explained earlier by Tina, that put some several formulas together to make a great team. We don't do it individually. Teamwork is the most important. Good questions. Do you use circulating sand gel someone after a large surgery or operation? That depends the patient's condition. If the tissue they operate is still inflamed or not, or still have some pain or something, you have to justify by yourself. The patient's condition is full of dead blood or full of inflammation. If the inflammation is pretty high, we have something coming up next. Why don't you use 少腹足鱼汤 for lower jaw? 少腹足鱼汤 is for warming up the lower jaw. It's not for the pain. I use it for infertility, for people with endometriosis, which is considered to be a very severe cold condition and constriction. I don't use it for abdominal pain. Can 血府足鱼汤 be used for high pitch? Try it. It might work. 栀子大黄 阴沉 北阴沉 ask Tina. Okay. Compare circulation sand gel and what is 水蛭. I like this 水蛭. 水蛭 is a very good, but it's too expensive and a little bit dangerous because I'm not sure about your patient. Are they anemic or not? Are they taking any blood thinner or something? So I just skip the 水蛭. You can add it individually if you discover the patient is severely jammed, blood stagnation, especially cuckoo, emotional disturbance, crazy people with crazy thoughts or uncontrollable behavior or bipolar, whatever that condition, you can add little 水蛭. But be careful, huh? Would you use circulation large? I never heard of it, that term, sorry. Okay, compare. Huh? Oh, mighty combo, pain combo, circulation sand gel. Like I said, mighty combo is for people with lump inside, not just injury or blood stagnation. Pain combo is for unknown condition. You don't have time, you don't have ability to make the proper diagnosis, and the patient is complaining, oh, I have this pain, I have that pain. You don't even know the pain coming from the internal organ or from the extremities, from joints, or from any spasm or something. You just simply use it. Circulation sand gel is more for pure blood stagnation. How do you justify it? Use the ear point. If you have time, learn my pulse diagnosis. My teaching all this for 45 years, including 25 years in Taiwan, 20 years. that the major goal of my study and my teaching is let you do diagnosis without asking patient first. My goal and your goal should be don't ask if you want to be a successful doctor. Don't ask a patient, hey, how do you feel today? What can I do for you today? Don't ask him. Directly, instantaneously take the pulse, watch the ear, watch the body signs, and tell your patient what's wrong with them. That's the only way to gain patients, the confidence from your patients. They won't treat you as a painter. They will treat you as artist who knows everything. And all the patients, all your money will come pouring in. So if you can, or if you don't do it now, you should try. Don't ask. When the patient sits in front of you, take the pulse, watch the body signs, watch the ear signs, and tell them what's wrong with them. If you want to be a good doctor, do that. Cystinuria, never heard of it. This is Chinese medicine. This is not a medical school. After recently attending, this is a very clinical manual. You can read it by yourselves. So this is good, successful condition of circulation sand gel. Was a result of a cliff 5 years ago, in which he sustained extensive crashing injury to the bones. 3 surgeries to attempt to repair the damage. That's the good word for using circulation sand gel. Most of the time, he could not stand anything touching. What a poor boy. Then 2 weeks ago, I put him on circulation sand gel. The first week, some diminishment of pain occurred, but the second week, because the medicine is moving the blood. But the second week, he was in America. He came to his appointment with his shoes on. Isn't that great? Later on, they damaged therapist. It was like massaging a normal person. Thanks again. Of course, that's the great achievement. As update this week, when I saw this young man, he had a little continued improvement. What we were talking about. See how great our Chinese medicine is? Okay. No, I'm not going to take a break. I don't care if you're tired or not. I'm not. I'm going to keep on talking. Okay? Continue. Sure.
Ready?
Yes. This is a question. Can people take all 3 together? You don't need that.